Welcome, everybody. Glad to have you here. If you signed in for our Councils in Conversation with the Greater New Haven Chamber of Commerce, I'm Ray Andrews. I'm the Executive Director of the Quinnipiac Chamber of Commerce. I'll be moderating our panel discussion here this morning. We'll be getting things going in about 2 minutes from now. So get your coffee, get your tea, your orange juice, relax, and we'll be going on in about 2 minutes. I want to welcome everybody to our Councils in Conversation with the Greater New Haven Chamber of Commerce. If you're just joining us, we'll be starting our program very shortly in about 30 seconds, 45 seconds from Mark. So stand by, relax, get your coffee, and we'll begin our program shortly. Good morning, everybody, and welcome to Councils in Conversation. It's great to have you here. I'm Ray Andrews. I'm the Executive Director of the Quinnipiac Chamber of Commerce. We're an affiliate of the Greater New Haven Chamber of Commerce. I substitute for our President and CEO, Garrett Sheehan, who has another commitment here on this Wednesday, could not join us. But it's great to be with you, and we have a terrific program planned for you as part of our monthly Councils in Conversation. And we'll be hearing from three panelists who are expert on the topic of promoting telehealth services, providing better access to healthcare for your employees. The Greater New Haven Chamber of Commerce is just delighted to have excellent premier investors who make all of these programs particularly helpful as a service to all of you. They're invested in our community, and you can see not just our premier investors, but the key investors who also make this programming possible too. And again, please note the names and see the logos. They're very important in promoting assistance to our business community with some of their expertise. And we're very grateful for what they do for us. We'll be introducing our panel in just a moment. We certainly would like to mention that Harvard Health has done a great job, Harvard Pilgrim Health, to help sponsor the Healthcare and Life Sciences Council of the Greater New Haven Chamber and all of the affiliates. And here from Yale New Haven Health and part of the council is Andrew Orifici, and he will be welcome you all as well. Andy, take it away.
Thanks, Ray, and good morning, everyone. Thanks so much for being here today. As Ray indicated, my name is Andy Orifici. I work with Yale New Haven Health. I serve as the chair of the Healthcare and Life Sciences Council here at your Greater New Haven Chamber of Commerce. We're very excited, my colleagues and I from the council, to bring you today's program. And we're especially thankful, as Ray said, to Harvard Pilgrim, who is the sponsor for Councils and Conversations for the Healthcare and Life Sciences Council. I want to thank everyone for being here today. We're really looking forward to a great panel. And Ray, thanks for having me on.
You bet, Andy. Great to hear from you too. So we're going to start our program now. We also will welcome your comments in the chat room if you'd like. Perhaps about half hour, 45 minutes in, we'll be taking a few of those questions at the end of the program. So we'll hope to conclude about 9:30. We may do it earlier. We will go no later than 9:30, being respectful of the doctor's time, our guests, and also your time here this morning as well. And our topic is, of course, telehealth, which has been transformative, particularly during COVID-19. We'd like to welcome our guests here this morning, our three panelists. Dr. Jim Carden, he is the EVP, Chief Clinical Integration Officer, CEO of Integrated Health Partners for Hartford Healthcare. And it's good to have you, Dr. Carden, with us here this morning. Thank you. Also with us this morning is Dr. Barry Stein, and he is a MBA, of course, and other distinguished honors as well, and Chief Clinical Innovation Officer, Chief Medical Information Officer for Hartford Healthcare. Dr. Stein, thank you too for being with us. And our other panelist here this morning is Dr. Scott Sussman. He is Physician Executive Director of Telehealth, Assistant Clinical Professor, Yale New Haven Health and Yale School of Medicine. And thank you three for being with us here this morning to talk about this topic, which I think if we were to dial it back 10 or 15 years ago, we're certainly far away and far removed from those Norman Rockwell images of the doctor in his quaint little office. Healthcare and its access points now for individuals and companies has changed dramatically. So I'd like to start, and I'll start with you, Dr. Carden, if I might, to answer the question. Then we'll, Dr. Sussman and Dr. Stein, if you'd like to just chime in as well, you're welcome to do that. But we really want to set what it is. What is telehealth? And describe it in generic terms and how it's evolved over the last decade or so, Dr.
Sure, Ray. As you stated, what telehealth does is use virtual technology. So our ability to connect to patients through technology, and that would be everything from seeing patients through a function like this in Zoom meetings to where you're having a conversation and being able to work through patients' problems like you would in an office visit, but without physically being present. And all the way through, ways of monitoring patients, getting information outside of just conversations and histories, we call it, to be able to determine and assess a patient in their home. It's an extension really of something that's gone on for a long time, and we've done telephone visits with patients for a long time, counseling, answering questions and those sort of things. So it's really an enhancement of a capability that we've had, but never robustly really deployed in a more strategic way to improve access and help patients deal with their acute issue, chronic issue, and being able to better give them the information and their providers the information they need to care for themselves. So it is a significant advancement and gives us much more capabilities to really do a better job of helping people manage their health.
Interesting perspective. Dr. Stein, in your experience too, someone I referred to this telehealth emergence as the new house call, because you can actually get in someone's house.
Yeah. The whole concept of technology opening up the aperture of opportunity to provide care anywhere, at home, on vacation, in your hotel, in your workplace, is very provocative and not futuristic at all. It's really the ability of our current status to be able to deliver on that. In terms of a house call, I will say is, I'll age myself a tad, but I used to do house calls. You just get into a car, go into somebody's home, and it's tremendous now to have the ability to provide a virtual health house call, not only for the convenience of the patient, which clearly it is for those that may not be able to get to the doctor's office, but for the physician to be able to see into the home, the surrounding of the home. The environment of the home really adds a lot to the diagnostic as well as therapeutic capabilities long term.
Well, it's exciting possibilities, as you mentioned, and transformative. And Dr. Sussman, I can only imagine among your colleagues, this may come in the emergence of telehealth as somewhat of a exciting tool that can be used and make healthcare delivery systems a lot more efficient.
Yeah, you're absolutely right. When telehealth started to grow here, we had small pockets where it was being used for the past 5 or 10 years even, but being able to use this tool to see patients not only when we are in the clinic, but also when we are at home. So it gives all of us clinicians some added flexibility in caring for our patients as well. And also being able to engage, as Dr. Carden mentioned, with the other diagnostics. So when we can have some more data, so we can know what someone's blood pressure is, we can know what their blood sugars are, and to be able to use that to provide really outstanding care, even when we're not able to be together, is something that our teams are really excited about.
Yeah. Well, I'd like to ask Dr. Stein this question. We had a brief chat yesterday prior to our meeting here this morning about specialists, and we'll get into specialties a little bit later in our discussion. But think of types of delivery. Mental health, for example. Mental health care is an obvious example, and some other niche. You mentioned gastroenterology, which is sort of fascinating to think about. But Dr. Stein, describe sort of the specialties and how specialists now are able to easily deliver quality care to someone through telehealth.
Oh, Ray, thanks for that question. I think first and foremost, the ability to deliver behavioral health or mental health care through through virtual health is incredible for all the reasons that you may imagine. The stigma of coming to the doctor's office, the stigma of being in the waiting room, and to be able to provide that care in an effortless way is profound. And I think in terms of the future as to what the opportunities are around delivering mental health care, virtual health is going to have a huge, huge impact. So that's one specialty, at least in our organization, that is right at the top in terms of utilization. The other specialties that are very interesting and very exciting, you mentioned a few, the cardiologist, to take care of the patient with congestive heart failure, to be able to take care of a patient in a remote way by connecting a blood pressure cuff, by connecting a scale, as well as the ability to interact with the patient at home. We can take care of our patients from a congestive heart failure standpoint far more effectively. COPD, similarly, we can take care of these patients that have chronic obstructive pulmonary disease that ordinarily come back to the hospital very often, much more effectively now with not just the ability to see the patient, but to connect the peripheral devices that allow us to monitor the patients that Scott mentioned, that we can do easily. And just for an example, during COVID, when our hospitals were at capacity, we really needed to try and get patients home earlier for a couple of reasons. The first of which, to improve the recovery at home. Most patients recover faster at home, but also to free up capacity for patients that needed beds more acutely. Our ability to take care of those patients at home was very dependent on the virtual health technology. The outcomes were better, the patient satisfaction was better, and we were able to increase capacity in our hospitals because of that technology. So there's just a few examples of specialties. I can go on and on.
Well, and the list does go on and on. You're right. I mean, because there is a multitude of specialties as well. Dr. Cardin, I was thinking, in terms of what Dr. Stein just mentioned about privacy and patient confidentiality. We have HIPAA laws. We really, as patients, want to not share much of our personal health struggles or challenges. So the privacy issue really is at work here, and that's where you see perhaps a wonderful pathway with emerging use of telehealth.
I think there's a couple of really interesting things. And as we look at it, as Barry was talking about the various ways of which what conditions can be managed, it's also using more than just what a lot of us think about telehealth, which is having a virtual visit like this to really engage patients in a very personalized way. How do we get to not just talking about patients with congestive heart failure, but Tom, who's got congestive heart failure, and be able to interact with him? And it's connection with your clinicians through this. There's also ways to interact with patients through their phone and to help them self-service and check in a very automated fashion, by which you say, hey, did you check your weight today? Did you check your sugar today? What is it? If it's high, did you follow these steps? So to help people self-manage a lot of their chronic conditions, when you think about the specialties, becomes very important. And that all needs to be very secure and very specific. So as we balance, and it's very important, as we know more about you, there's some exposure there that people will feel that, gee, you know a lot more about me than maybe I was initially comfortable for. But when you know who you're talking to and who's directing that care, and so it's very important as we move forward, it's not just that we can secure the information, because I think we can do that very well. It's the trust that needs to be built. And although technology allows you access, so much of healthcare is that personal relationship with your caregiver that needs to be involved. Also broadening the group. Not only are you communicating with the patient who's got a chronic condition, but the daughter, the son, the other caregivers that need to be informed can be really helpful in helping manage their conditions as this goes forward. So as we think about when I hear the privacy, there's a trust piece that I always hear in that question. And it's really important that that trust remains very firm, that you know who your clinician is and you have a great deal of faith in their curation of your disease or illness.
Dr. Sussman, I want to ask you a question about on the same lines as Dr. Cardin and Dr. Stein just mentioned about the different specific challenges that are being faced as well. One of it is understanding the technology and just getting comfortable with it. And some people, of course, at various ages, may not have a computer, may not have a smartphone, may not understand MyChart and how to work with various apps. So how do you help them walk through the technology so that patients have a certain level of comfort who are not historically, specifically older patients, used to working with this technology?
It's a great question, Ray. So COVID did a lot of things. Many were challenging for us. Some were beneficial, and that was having people be more familiar with technology. So we've gone through a few iterations of our platform. And what we found is that making sure that it's as easy to access as FaceTime or some other programs that people are more used to now was one of the goals that really let us have a patient-centered approach. That being said, there's still people that were not comfortable with this. And we put together a telehealth assistance group that reaches out to people when they are signing up for their video visits, so we can help walk them through the technology, make sure they're able to get connected. And there are still people who, even with that assistance, just don't feel comfortable. And the reason I bring that up is telehealth is a phenomenal tool, but it's not right for everyone for every condition. I really see a hybrid approach going forward, and there are times when a video visit is perfect, when it's desired by the patient and clinically appropriate, and there are times when seeing your clinician in person is really the best care. So figuring out where those gaps are, figuring out how with education we can help an additional group of people get comfortable, but then also acknowledging that video visits are a tool that we'll use for many patients. We've also done work around securing grants to help people get technology if it's really the inability to access the technology as opposed to a technological literacy piece. So lots of work, it's exciting, and we'll continue to partner with people around that.
So associated with that, Dr. Cardin, I'll actually throw this question to you in terms of organizing not only the apps, but for patients sort of to be comfortable with the technology and understand that they can now have excellent personal record keeping. They have a blood pressure chart, they have a glucose chart. And it's almost like today you can track your own financial investments the same way by doing this online. So let's talk about the organizational aspect if we can, and what we all can learn a little bit of how we can organize instead of putting them in a manila envelope, just going online and getting our information.
It can be extremely powerful, right? I mean, giving patients their information and being able to have it all in one place is really important. We found that across Hartford Healthcare as we've been very purposeful about trying to get everybody on a single platform. And the ability of patients to interact with that, it can get better, it can get easier, as Scott was talking about. I think that we've got to continue to pay a lot of attention to not everybody has the access, so you can't completely depend on that. The only way to really connect and give the patients their information, but it can be extremely powerful. There's still some clunkiness. Patients don't completely stay in your environment, and we know the interface when people are leaving the environment and seeing other clinicians that aren't necessarily on your platform can create some difficulties to make sure we're incorporating all that information. So there's work to be done. I think most patients that I care for sort of assume that you're aware of everything that they've done in healthcare as they've moved around. And it's sometimes, and rightfully so, they kind of slap their forehead and said, I can't believe you can't get access to that, right? I mean, there's an expectation that this should all be available, but we've got work to do there. I think again, organizing of it and the ability to really manage it and put it in a presentable way to make it powerful for patients. I still worry too much time. We give them information, but without the context or the understanding around it. We give them their lab results, but are you really using that interval where people have a great deal of expectation. I'm waiting for my labs to come back, to use that to educate, inform, and continue to motivate in a much more robust way than here's your blood count, here's your cholesterol numbers. What do they mean? And how do we make sure that that comes through in a very clear way? I think we have opportunities there.
So, Dr. Stein, thinking in terms of user friendliness of the apps and the charts that a patient would use, but also from your perspective as a physician in terms of interacting with a patient, telehealth certainly makes your work easier in many ways. We're certainly hearing and commanding that as a positive here through this conversation. But in terms of the patient, they have medication reminders. They have to schedule appointments, just like other things they have to organize. So, Dr. Stein, if you can talk about how this has benefited you as a medical professional.
I think Dr. Carden mentioned most of the opportunities and benefits related to the patient having information. And it goes back to, I think, what Scott said and Jim said about that personal relationship. If we can connect with our patients, knowing that they are familiar with all their data and results and have sort of thought about it before they've visiting us, it becomes a much more effective conversation. It's a more educated conversation. It's a more meaningful conversation in the short amount of time that we have with our patients ordinarily. So when it comes down to that patient information sharing, which is, I think, critical in this conversation, if we can just sort of look at the scenario, I'm going to be seeing a patient today, virtually. It would be really great to know that the patient is comfortable with the technology, has seen all the results that I ordered, has the questions written down potentially that they want to ask me, have organized their thoughts within the 10, 15, 20 minutes or 30 minutes that you have with the patient. You can really have a very impactful conversation for the patient. So here, that's the one piece. Now, I want to go back to what Scott said about the technology, and this is a concern for all of us, and certainly at Hartford Healthcare in terms of health equity. We have to be very mindful that all this technology can not only sort of impair access, but really make it far worse than it is right now, just because of that digital divide, that inability to get that information. So I think as physicians and clinicians and healthcare providers, we have to be very focused on that particular problem. Every single time we see a patient, we can't assume that anything's easy for them, anything is comfortable for them, not just technology-wise, but in a social setting, do they have the right location to be able to interact? So those are the kinds of things that go through clinicians' heads at the moment when they have the opportunity to interact virtually.
I think you picked up on an excellent point, Dr. Stein. If I could just, with you, carry that a little further too. Thinking in terms of the urban-rural divide as well. Many patients may live an hour away from a health facility, and certainly in underserved neighborhoods where there may not be as many laptops or easy mobile devices. The elderly population, there are underserved populations that may not receive this treatment very easily. Is that correct?
Very, very definitely.
Yeah. So, Dr. Carden, from your perspective too, have you seen at Hartford Healthcare sort of studies or internal understanding of the widest scope of all the patients and how may perhaps 20-25% may not easily access or have an opportunity to use telehealth in a positive way?
Yeah, and I think it gets a little to what Scott was talking about, is that this isn't going to be for everyone. I'll give you an example in a way. We were going through both our vaccine and testing. We had as all the health systems did, we had a very clear focus to try and get to underserved areas. And we recognized that sometimes the ease at which folks who are in more better economic services, better environments, have closer access, don't have ride challenges, and don't have the access to technology to easily schedule an appointment or do things. We had to incorporate that into our thinking to give them another way to get those kind of appointments. We had to give them a call number that they could do, and we would help facilitate that. And in fact, we had to sort of really partner in a very different way to solve some of those issues. So telehealth is not going to solve all of it. It helps some, and it certainly removes some of the barriers to access, but we've got to be very thoughtful that as we go down this path, that we are constantly challenging ourselves, as you are doing in these questions, not to assume that everybody's got the same access to technology and other sophistication in terms of get there. Sometimes it's age, sometimes it's economic circumstances, sometimes it's the environment people live in. There's a whole bunch of things that we need to put this in the right place to where it can be helpful, but not to the disadvantage of those that don't have necessarily the same capability of accessing it.
Yeah, well put. Dr. Sussman, picking up on that point from Dr. Carden, in terms of accessibility, we talked about elderly and other underserved populations. Rural populations may not have easy access to a medical facility. Certainly children. Another case, if you're a pediatrician or an obstetrician, you certainly want to see your patient in person.
It's a great point. So I'll use a personal example. So my daughter had a health condition. We called the pediatrician's office. They defaulted to a telehealth visit. It was kind of their standard. We were able to be seen the same day. It was phenomenal. It would have otherwise required me to take the afternoon off of work, me to pick my daughter up from school. This really allowed a level of convenience that historically was not there. One other thing that I want to share is we've seen that with the ability to do visits via telehealth, our primary care center, which serves a socially disadvantaged group, they've seen their percentage of patients being able to show up for appointments increase since they were doing video, because it removes some of the other barriers that have been brought up, the transportation, the ability to get off of work. It allows people to have a 15 or 30-minute visit actually take 15 or 30 minutes. So it's something that has been really nice, and it is a balancing measure to all of this other work that's going on.
Parking issues, we've heard that in New Haven, next to medical facilities, near the hospitals, for example, and that's another major challenge. This is Counsel in Conversation with the Greater New Haven Chamber of Commerce. I'm Ray Andrewson, Executive Director of the Quinnipiac Chamber of Commerce. We have three distinguished panelists talking about telehealth, telehealth services, providing better telehealth and access to healthcare for your employees today. Dr. James Carden with Hartford Healthcare, Dr. Barry Stein, also with Hartford Healthcare, and Dr. Scott Sussman to Yale New Haven Health, Yale School of Medicine. We just talked about the access and the parking and some of the logistical challenges of an actual visit. Let's talk a little bit about the softer aspects of this, if we might. The doctor's visit, and I brought up the Norman Rockwell image, the one-on-one in-person image. Many of us associate being in person as being the place where we can feel particularly intimate, that we can be more sharing of information if we're behind a closed door. The magazines are better in the office than if you're in the waiting room online. You might even get a lollipop, no matter what your age. So, Dr. Sussman, I'll throw it right back to you. You're talking about what it's like to have a child go to the office. Is there an empathy level that's increased in person, or how can we achieve empathy in healthcare delivery online?
This is a really important topic. And I think part of the thing that we as a healthcare team nationally are really focusing on is how to make sure that our patients feel comfortable with video visits. There's a whole area called webside manner as opposed to bedside manner that people are focusing on. It's what are those skills so that we connect with our patients. Some of them are pretty obvious, so make sure that you're looking at your camera, you don't have a distracting background, you're not typing or looking at your cell phone. So some basic things that we would do as part of the in-person visit. And it's bringing that level of attention and focus to the patient that really helps them feel that they are really having a clinical visit, even though they are doing it over video. So those small things can go a long way and can help really help patients feel that they are connecting the same way as an in-person visit.
So, Dr. Carden, you have to do a lot of training staff training, make sure everyone who, from the delivery perspective, is employing the same empathetic markers that Dr. Sussman was talking about?
Yeah, it's a skill set, as Scott was talking about, I'll, from a patient perspective, their comfort level, but there's also a clinician perspective that they have to get comfortable and be very intentional about it. And this technology is great, but it is fundamentally different than being in a room with a patient. I don't think there's any substitute for the cues that you pick up, the body language that happens. There's just a lot that, as a clinician, informs and allows you to develop the relationship that leads to the trust and the intimacy that is really required to deal with all of the issues that are happening. So I think that there's, and I haven't completely figured this out. Some patients seem very comfortable. Others are very reserved. And I, having known them for many years, I know what they're like in the office. And when they're on the video visit, it ain't the same. And you can just feel it. So, there's a piece that you just have to acknowledge and plan for in terms of the purposefulness of these visits. And I suspect it's not only, there probably won't be a one size fits all. I suspect we're going to have to, again, individualize those that this works really well for, and some that where it just doesn't seem to accomplish the goals that you want to do, and have to be thoughtful about how you incorporate this into the individual care of your patients as you get to know them. So more training, yep. Attentiveness, making sure that you're not distracted. It's a lot easier to be distracted than being in a room. I mean, you see it in meetings, right? We see it all the time. Everybody should be paying attention. You see those eyes wander, you go, they're doing something else. And we just got to be really thoughtful about it, that this is your full attention, and that you're really weighing all these various issues as you're trying to care for people.
Well, we've been talking about delivery as in the aggregate delivery of health care as a system, but also the delivery of a diagnosis. And in terms of walking a patient through what might be a emotionally and physically challenging period of time. Dr. Stein, let me ask you about this, because as someone in the medical field, you've had good news to tell people, and you've had some very bad news to deliver to people. Certainly online, it's difficult if someone is isolated and not in person to hear that they have cancer, severe heart disease, diabetes. How do you manage the nuance of providing the information to a patient and using this platform versus being in person?
I'll give you an example about that kind of scenario. And we set up a multi-specialty virtual visit for patients that have prostate carcinoma, so newly diagnosed prostate carcinoma. So I'm going to answer it in a slightly different way. So ordinarily, if you're diagnosed with something like prostate carcinoma, you've got to see your medical oncologist, you've got to see a surgical oncologist, you've got to see the radiation therapist, then you've got to wait for all of them to sort of discuss best planning, and then somebody will get back to you.
Yeah.
And that's an anxiety-provoking journey without this technology. So let's bring in this technology into that equation. We now have the ability for a patient in a single sitting to see their medical oncologist, have a warm transfer to the surgical oncologist, and then move on to the radiation therapist. And then the fourth visit is everybody in one visit discussing best treatment options. So by the end of that visit, hour and a half visit, the patient has a full picture of what's ahead. Now, I think that that's actually extraordinarily impactful, and is in order of magnitude, I would argue, more beneficial for a patient than going through the in-person visits, one day at a time, or whatever that may be. So I think delivery of care in that way, under difficult circumstances when dealing with a difficult diagnosis, is extraordinary. Now, again, that's not for every single person. But I just share that example because that's a real example of what's happening and how this technology has changed delivery of care for patients that are facing very anxiety-provoking diagnoses.
And Ray, it's leaning on with Barry. It's not only that multiple clinicians can all meet with the patient at the same time, but the son in Florida can join that conversation, right? So he would have had to fly up, be present, or get the secondhand information, or have follow-up phone calls with all these. The patient can have their support system, even if they're remote, participate in this meeting, which can be just incredibly powerful. So you're trading off, but it really does create a much better experience in a lot of ways, and a much more efficient way to get to clarity and know what's the decisions need to be.
An excellent point. In terms of thinking, not just getting on an airplane, but now we see that a family, loved one live miles away, 500 miles, 3,000 miles away. So in our global environment now, we can actually join in if we have aging parents and be on the screen and provide some reassurance by being the familiar face in the room, especially at a traumatic time like that. Dr. Sussman is, you direct the telehealth efforts at New Haven Health, and you've seen how this has worked. Let's talk about when things are irrelevant or what doesn't work. And you can cite some examples, things you've learned. So through trial and error, that's how we do things in the medical field, I guess. Through trial and error, what have you learned, Dr. Sussman, that seems to work better, and what doesn't seem to work at all, and it is really makes this whole system of telehealth irrelevant?
Great question. So there are a number of conditions where the physical exam really is important. And we've learned over time that making sure that we're pairing things up, and again, it comes down to that clinical appropriateness as part of the decision to have a visit via telehealth. One example is our neurologists were initially excited to do video visits for patients with headaches. Seems like a great opportunity. So part of that includes a exam of the back of the eye to make sure there's not increased pressure that's causing the headache. So that program has paused. However, we've recently learned that our ophthalmology colleagues do a lot of video visits, and they've figured out some really innovative techniques to be able to perform that eye exam. So it is an iterative process, figuring out what works and how to use the technology to facilitate that best patient care. Other examples where we've seen good uptake is within our digestive health team, as well as post-surgery. And there were some papers that came out looking at patients that had surgery and needed to have a post-op visit for a wound check. And the outcomes with video visits were comparable to in-person, though again, that 15-minute visit is actually a 15-minute visit. So it's finding those areas, sometimes being creative, speaking to other specialists who might have figured out how to do parts of an exam that one specialist had not yet discovered. So it is iterative and figuring out the best way to provide that care for the patient.
Well, I can only imagine, and I feel this way as just a layperson. It seems that the terms medical and miracle seem to align and connect. And it seems like a somewhat of a medical miracle that you can, from a distance, understand a person's heart rate, glucose, hypertension, they have sleep apnea, sleep issues. And Dr. Sussman, I'll just ask you, I'll start this way, and Dr. Cardin and Dr. Stein, by all means, jump in if you like. It seems like a miracle, I'm sure, to you, because the technology is advanced. But practically, how do you do all this stuff? It just seems so not very understandable to we lay people who just don't get it.
So technology has advanced significantly, and what used to be miraculous is now commonplace. We don't think that the fact that we can use FaceTime or Skype to make a video call is amazing. It just happens. So in the background, there's been a lot of innovation, and it's found its way into the everyday practice of medicine. You mentioned being able to look at blood pressures, blood sugars. We also have the technology to listen to people's hearts remotely. So being able to get that information in an audio file to the cardiologist so that they can listen to the person's heart murmur or listen to the lungs. This is all happening now, and it is continuing to evolve every day. I imagine Dr. Stein and Cardin also get input from a lot of innovative companies that have new technology that is going to really continue to transform the way that we provide care. And it's as simple as collecting the information. You still need to do that. And that's where the hands-on approach makes sense. And then facilitating the transmission to one of our electronic health records. So it is a process that built upon technology that started outside of healthcare, and we're really taking advantage of it now to transform healthcare delivery.
Remarkable. Dr. Stina, too, you have the lab coat behind you. So you look like you're actually in a medical office with the lab coat today. But you can actually bear down and get the information remotely. That speeds up the process of diagnosis, doesn't it?
Yeah, well, I think I agree with everything that Scott was saying. In terms of the wearable devices, I think everybody nowadays is very familiar with wearable devices, the watches, the scales, the Bluetooth-enabled devices. And all that information, I think, initially folks thought it was for themselves only, and we couldn't really share that with anybody else securely. Well, that's changed dramatically. You can share all that information effortlessly, seamlessly with your provider who integrates that into their electronic health record. And that's the opportunity for innovation today. So when we started the conversation, it was virtual health, it's seeing each other, but not really being able to examine the patient as effectively as you can do in the room. Well, all this innovation occurring around wearable devices, biometric devices, to be able to transmit your sugar, to be able to transmit your blood pressure, your weight, your temperature, your pulse oximetry. All of that information is all the information that you ordinarily would have had to sort of undergo in the doctor's office. It's now freely available for a clinician without having to see the patient. So now we've got a tremendous amount of data as clinicians that potentially is coming into the medical record. The opportunity now is for us to change all that data into very meaningful insights. So if I get a blood pressure reading every minute of every day, 24 hours a day, that's an enormous amount of information to integrate. Think about temperature and all the other different biometrics. The innovation, the opportunity now, and where the focus is now is how do we take all that information, distill it into meaningful information that I, as a clinician, can take care of my patient in a more personalized, coordinated way.
I think the opportunity here is that there's a huge opportunity. I'll give you a really interesting example I heard about in a discussion in a meeting I was in, but it's you need the resources to be able to actually turn that information and who is going to take care of it. Because now that you have the information, you need to respond to it. It was a really interesting, just to give you a perspective of where this can go, conference I was at discussing trying to incorporate all of this robust data. They did a small study, remote monitoring on patients with seizure disorders. Obviously, the risk of a seizure disorder is the unpredictable events. And how do we start to get to a place to where we can help people say, you know, being at the top of the stairs when you have a seizure is not where you want to be, so to speak. They started aggregating just a whole bunch of data. And what was fascinating is, although they were looking for, are there signals that would start to come across in terms of the data they would have that would say, hey, we see this pattern before a seizure is going to occur. What was telling in the comment was, in the patients that they're monitoring, they no longer had to look up the name to see who they were. Just by looking at the patterns of the information came in, they said, well, that's John's signal right there. I know it. I recognize it. He's always doing, his pattern is always this way. And to me, that was just so telling, is that they got so familiar with the individual sort of data they were collecting on each patient, not only looking for signals, but being able to, without looking at the name, know who they were. And the power that this could get to is just fascinating to me. A little scary, but fascinating.
Well, Dr. Card, it's not scary. It's shared information. I think we all hear in the course of the day, sadly, ambulance sirens and emergency response teams going to a medical emergency. And we're often in terms of shared information, at odds with going into, it seems, many specialists or other offices and putting in the same information all over again.
Yeah.
So we're always being asked the same medical questions over and over and over. How do we get this synergy so that all three of you are getting a profile of a particular patient, especially in an emergency response time? That an emergency medical team, if somebody has a heart condition and they're having a heart attack, they're calling 911, someone's showing up at the doorstep, it's a life-saving emergency. How can we get that information to that team so they can better handle that situation?
Yeah, and that gets a little bit to where we're talking about. There's still some clunkiness between integrating all that information so that the person, and you see a lot of companies trying to take the disparate information sources that have information about me and my health to make sure that I have it and everybody has access to it who I want to grant it to. Right now, a lot of that information is still siloed in lots of different places. And you're absolutely right. The frustration of having to ask over and over again. We work very hard that at least within our environment, we're not going to ask you the same question that we asked yesterday in another office of ours. And that alone has been a work in progress. You'd think it'd be easy to do, but it hasn't always been. As we cross over and you're getting care at various places that are not directly connected with our healthcare, for example, or Yale or any other provider or system, how do we make sure that the patient's record follows them wherever they're going to go? It's still very much, in my view, a work in progress, right?
So, Dr. Sussman, I'll ask you, in terms of sharing that information, we seem to have two trains of thought going at the same time, which is accessibility of information, being able to provide immediate assistance to someone. Certainly during COVID, people are sharing personal information. Have you had certain symptoms? You walk into a restaurant, they may ask you, how do you feel today? Have you had a fever? They're asking you personal health questions. At the same time, listen up, HR departments, we have HIPAA. We have privacy laws that don't allow access to certain medical records. So Dr. Sussman, how do we navigate this conflict?
It's a great point, Ray. And a couple things happened around the same time. So certainly COVID brought people's personal symptoms to the public health level. So I think that's one thing. In April of this year, the 21st Century Cures Act was put into place. And I believe Jim mentioned this as well, that patients have access to their data instantaneously. So if you have a lab result, you will be able to get that result immediately. It's federal law. We all have adjusted our systems to allow that, as well as our notes. So as a patient, I can see what my doctors write after I see them in the office, and I have access to that. So there's a level of owning someone's data, our own data, that has really been increased due to the legislation that went into effect earlier this year. That being said, there are still places where the data does not flow as easily between different systems. Connecticut is fortunate that we have a health information exchange, which allows us to share data in a HIPAA compliant and protected way so that we can provide better care for our patients as they move between different parts of the health systems and the state. And the ability to share information related to COVID, I want to make sure that it does remain as a subset of the health information that we share, because I think we all agree that health information is private, and we want to obey HIPAA while also keeping each other safe. So there's that fine balance. Technology does facilitate that. I don't know if people have used the QR code on their phone, if you've been into New York, but it works well. And then we're not really asking questions. It's just more of a check the box. So I think there are ways to keep each other safe while still protecting our health information.
And of course, there's always the issue of hacking. It does happen. We're on a Zoom call here. We certainly want to take precautions to make sure we're not hacked. And Dr. Stein, there are the issues related to who's going to access the information and not be up to be up to no good. Are you concerned as a medical practitioner that perhaps there is a breach of confidence by using a digital platform as opposed to being in person?
You bring up a very important topic, which is the whole topic of cybersecurity in healthcare. We've all read about the healthcare systems that were hacked and were brought down for weeks with huge ransoms. It's very, very significant. The second piece is because of so much of what we do is digital, whether it's the EKG monitor in the ICU, whether it's the ventilator in the ICU, whether it's you using your cell phone to communicate with your clinician, all of that is digital. All of that is potentially vulnerable to anybody wanting to hack that information. With that being said, most healthcare systems now are doubling down, quadrupling down on cybersecurity to try and prevent that every single minute of every single day. And I'll just bring it down to the level of just the simplicity of using your phone to communicate with your clinician. Someone would say, well, why couldn't you just pick it up and use Facebook? Well, Facebook is not encrypted. So most healthcare systems and most clinicians are using encrypted technologies that do provide that safeguard around hacking your particular interaction with your clinician. So those are the few thoughts that I had.
Yeah, it is. It's a major concern. I think cybersecurity for lay people, and Dr. Carden, you're a medical practitioner. You're not somebody who works on the information technology team, but you still have to integrate with them. So is your work, how integrated is your work with an IT team at Hartford Healthcare?
It's essential, right? I mean, we've gotten to the point to where IT becomes the fabric in which you have to do your work. It is what needs to work well for you to get your day done anymore. It just is. You're interacting with technology on your EHR and everything else. And it's got a plus and a minus. I would never go back to paper records, but the increased work, the steps that you have to take, it's different, and you have to think very differently when you're working in a electronic environment to document, see patients than you would otherwise. And so it's I think all clinicians struggle with the functionality in some regard, in terms of the electronic health record, in terms of the Zoom. It's all great, but it's not ideal. And I think there's still a great deal, and we spend a fair amount of time in optimization to try and really minimize the time you're taking care of the electronic health record versus taking care of the patient. And that's a balance. As cybersecurity has come up, the connectivity is very important. You just can't access things all the time. We're very protective about when you're in the environment and when you're outside the environment, what you can do and bring when you come back in the environment, because there's hyper focus on making sure that you're not introducing something into the environment that could cause the entire system to kind of crash down.
Yeah. Dr. Sussman, you had to get through medical school and residency and everything else. That's no piece of cake. That requires concentration. And yet you're having to learn new software all the time too. So how do you keep yourself fresh? I mean, just personally, as a physician, what are you learning with these software upgrades?
So it's a great question, Ray. And part of being a doctor is there is continuing medical education. So we all go to conferences, we take courses to make sure that we are up to date on the newest advances in medicine. And there have been discussions about having some CME or continuing medical education requirements or offerings around technology as well. Because as Jim said, it really does facilitate all the care that we provide, whether it's in person or via video. And delivering it in bite-sized chunks so that it really is just another tool that we're able to use. We found that to be the most effective way. And similar to the way that people who are outside of the medical field, there's new technology that is introduced, whether it was the Fitbit almost a decade ago, that was this new thing that how are we going to use this? All of a sudden it just becomes part of everyday life. And it's similar within healthcare. General healthcare is a little more conservative. So we wait for things to be really vetted in other sectors first. So generally, we're not trying things for the very first time when we're talking about patient care. They've been proven in other parts of the economy already.
That's remarkable. Well, we're coming up against the end of our discussion here this morning. Just got a couple of minutes and some closing thoughts from the three of you, which I'll ask in a second. And I'm sort of struck by a comparative sense of my previous personal career within radio broadcasting. When radio was evolving in the 1920s and 30s, a lot of people couldn't figure out how someone in Cincinnati or Chicago or New York could be heard in the living room in New Haven, Connecticut. How does that happen? This isn't telegraph. This isn't telephone. There's no wire. And rather than get into a discussion of amplitude modulation and frequency modulation and how that works, it is airless, if you will. There's no connectivity directly. So this is the same way. We have sort of a cyber connectivity together. So Dr. Sussman, you're sort of in your visioning of telehealth. Just give us a couple of your insights, your closing thoughts on the future. Where are we going in the next 5 to 10 years with telehealth? And Dr. Sussman, hand off to Dr. Carden. We'll hand off to Dr. Stein.
Perfect. So we are at a real inflection point in terms of healthcare transformation, and the use of technology will really move care from hospitals and clinics to homes, and patients are going to be able to receive hospital level care outside of our walls. So that's really exciting. We've already seen that it's not limited to video interactions and data coming through, but even performing surgery. So people thousands of miles away can have robotic surgery via telehealth that historically would have required either the surgeon and or the patient to get on one, if not more, airplanes to make that happen. So really an exciting time, and having video visits and remote patient monitoring be part of how we deliver healthcare is going to transform healthcare delivery going forward. So excited to be part of this revolution.
Yeah, I agree. I think that as we look at the work that's ahead of us, that I'm extremely excited and see this as an enormous opportunity. You know, our goal is to continue to improve quality, lower cost, make care more affordable and accessible. Without technology, that has been an unachievable goal. And yeah, I'll just state it outright. We've been trying to do all that for a long time and really haven't been able to do it. This affords us, still going to do more work. We're going to be more purposeful. We're going to have to be more strategic. But this gets us to a place to where we really can solve what I think is going to be the major issue that we're working towards going forward. So I'm excited. It won't happen fast enough, but certainly you now see a path to give us the infrastructure to accomplish our real goals. Barry?
I agree with both Jim and Scott, so I won't really repeat it. Suffice it to say, the one opportunity that I'm very excited about is, I always think about it like this: name one activity in healthcare that is as easy as downloading a book from Amazon onto your Kindle. And there's usually silence in the room. And I think the opportunity for us is, all of that is the friction that the patient has to experience to get healthcare. And in that space is all the opportunity to improve, and technology and virtual health and wearables are going to help remove that friction for us to be able to deliver care as seamlessly as downloading a book from Amazon onto your Kindle.
Remarkable technology. Well, we want to thank you three for a really engaged and extraordinarily informative discussion of telehealth as it pertains to now and, of course, the future. We thank you all for participating today. Dr. Scott Sussman, as the Physician Executive Director of Telehealth, Assistant Clinical Professor, Yale New Haven Health, Yale School of Medicine. Thank you, Dr. Sussman, for being with us here this morning. And Dr. Barry Stein is the Chief Clinical Innovation Officer, Chief Medical Informatics Officer for Hartford Healthcare. Again, thank you. And Dr. Carden, Dr. James Carden, Chief Clinical Integration Officer, CEO Integrated Health Partners of Hartford Healthcare. Thank you three for a very good conversation this morning. We also would like to thank Harvard Pilgrim Healthcare, who sponsors our council, bringing this to you today for our Councils in Conversation. We also want to shout out and thank Velo Airlines too, flying now from New Haven, from Tweed, starting this coming Wednesday, November 3rd. Their inaugural flight, which will be going down to Orlando, Florida, nonstop to Florida on veloair.com. So you can fly from New Haven to Florida now. So you can get your information by going to the Avelo website. We also have other events coming up here at the Greater New Haven Chamber of Commerce we'd like to let you know about. our annual Women's Achievements Awards that is right here with Quinnipiac Chamber and our other chamber, the Greater New Haven Chamber of Commerce. We're honoring 6 local, dynamic, powerful women in business in our community this coming Wednesday, starting at 11:30 at the Hilton Garden Inn in Wallingford. You can go to Quincham, QUINNCHAM.com, screen as you see, to register for that event. We'd love to see you on Wednesday. And then coming up, put down on your calendar November 17th and 18th. It's a big annual event with the Greater New Haven Chamber of Commerce. And that is Connecticut's premier business networking and information event presented by Comcast Business. And the Big Connect is virtual on the 17th, but in person, safely, from 7 to 4 on November 18th at the Omnia Hotel in downtown New Haven. You can learn more at gnhcc.com/events and register there. We'd love to see you then. For Garrett Sheehan, our President and CEO, Ray Andrewson, Executive Director of the Quinnipiac Chamber of Commerce, thank you for being with us today.
Thank you.
Thank you.
Thank you.
Thank you.